If you wake up at night to use the bathroom more than once, you might be brushing it off as just getting older. Most people do. But what if that one habit, along with four other things happening to your body while you sleep, is actually your kidneys sending out a quiet distress signal? Here's the part that should stop you cold. According to the National Kidney Foundation, approximately 37 million Americans are currently living with chronic kidney disease, and nearly 90% of them have absolutely no idea. Not a clue. The kidneys are one of the most deceptive organs in the human body. They can lose up to 40% of their function before a single symptom becomes obvious during the day. But at night, the rules change. Your body shifts into a different physiological state after dark, and that's exactly when these 5 warning signs begin to surface. If you're over 60, what I'm about to share with you could genuinely change the outcome of your health. I'm Dr. Sarah Mitchell, and this channel is dedicated to giving adults over 60 the kind of honest, research-backed health information that too often gets overlooked in a 10-minute doctor's appointment. If you haven't subscribed yet, please do that now so you don't miss what we cover each week. Now, let's talk about what's really happening to your kidneys while you sleep. Your kidneys are 2 fist-sized organs that sit just below your rib cage, one on each side of your spine. Every single day, they filter roughly 200 quarts of blood, remove waste, balance your minerals, regulate blood pressure, and produce hormones that keep your bones strong and your blood healthy. When they start failing quietly, the consequences ripple through nearly every system in your body. And because the damage is so gradual after 60, the warning signs don't announce themselves with pain. They announce themselves with disrupted sleep. Here is the first and most overlooked warning sign. You wake up to urinate 2 or more times every single night. This condition has a medical name called nocturia, and most seniors assume it's just a bladder issue, an enlarged prostate, or simply part of aging. Sometimes it is, but here's what most doctors don't immediately tell you. Healthy kidneys concentrate your urine efficiently at night, which is why young people can sleep 8 hours without waking up once. When kidney function declines, the kidneys lose that concentrating ability. The result is that your body produces more dilute urine throughout the night, forcing you awake repeatedly. A landmark study published in the Journal of the American Society of Nephrology found that adults with nocturia occurring 2 or more times per night had a significantly elevated risk of underlying kidney dysfunction, even before their standard blood tests showed any abnormality. If this is happening to you consistently, comment below and tell me how many times a night you typically wake up. Your response genuinely helps others realize they're not alone in this. The second warning sign is swelling in your legs and ankles that seems worse in the morning or after lying down overnight. You might notice your socks leaving deep indentations, or your feet feeling puffier than usual when you first stand up. This is called edema, and when it's kidney-related, it happens because failing kidneys can't properly remove sodium and excess fluid from your bloodstream. That fluid pools in the lowest parts of your body, particularly overnight when circulation slows. What makes this especially dangerous is that many seniors blame this on heart issues or standing too long. And while those can also cause swelling, kidney-related edema often comes with a specific pattern. It tends to affect both legs equally, feels soft and spongy when you press it, and can also appear around the eyes or face in the morning. A 2022 study from the Clinical Journal of the American Society of Nephrology confirmed that persistent bilateral leg edema in adults over 60 is one of the most underreported early markers of declining glomerular filtration rate, which is the technical term for how well your kidneys are actually filtering your blood. Now here is the third warning sign, and this one surprises most people when they hear the connection. Restless legs at night. That overwhelming, crawling, uncomfortable urge to keep moving your legs just to get relief? Research published in the American Journal of Kidney Diseases found that restless leg syndrome is up to 5 times more prevalent in people with chronic kidney disease compared to the general population. The mechanism here is important to understand. When kidneys begin to fail, they can't properly regulate levels of iron, dopamine precursors, and uremic toxins in the blood. Those toxins, the waste products that healthy kidneys would normally flush out, begin accumulating and irritating the nervous system. This irritation tends to peak at night when you're at rest and not distracted. If you've been told you have restless legs and were given a prescription without anyone checking your kidney function, it may be worth having that conversation with your doctor. This is not a coincidence to ignore. Before we get to warning signs 4 and 5, I want to tell you about Margaret, a 71-year-old retired teacher from Ohio who came to see me complaining of leg cramps so severe they were waking her up 2 and 3 times a night. She'd been dealing with this for about 8 months, attributing it to low potassium and taking supplements on her own. What her previous provider had never flagged was that her eGFR, the kidney filtration measurement, had quietly dropped to 52, placing her squarely in stage 3 chronic kidney disease. Once we identified the real problem and adjusted her approach, including stopping certain supplements that were actually stressing her kidneys further, her nighttime cramps reduced significantly within 6 weeks. Margaret told me that no one had ever connected the dots for her. That's exactly why we're here today. The 4th warning sign is nighttime muscle cramps, particularly in the legs and feet. Margaret's story ties directly into this one. When kidneys lose their filtering efficiency, electrolyte imbalances develop in the blood. Specifically, phosphorus begins to rise, calcium becomes dysregulated, and potassium levels can swing unpredictably. These mineral shifts directly affect how your muscles contract and relax. The cramps that result tend to be intense, often waking you from deep sleep with a sudden seizing sensation in the calf or the arch of the foot. Now, here's what most people miss. These are not the same as ordinary muscle cramps from dehydration or overexertion. Kidney-related cramps tend to be recurring, happen at rest rather than during activity, and don't resolve with simple stretching alone. According to research from the National Institute of Diabetes and Digestive and Kidney Diseases, persistent nocturnal muscle cramping in adults over 60 is significantly correlated with electrolyte imbalances consistent with reduced kidney function. If you are already taking magnesium or potassium supplements for cramps without improvement, your kidneys deserve a closer look. The 5th warning sign is one that can genuinely be life-threatening if ignored. Waking up at night with shortness of breath, or feeling like you can't get a full breath when lying flat. When kidneys are failing, fluid doesn't just accumulate in your legs, it can back up into the lungs, particularly when you lie down and gravity redistributes that excess volume. The medical term is orthopnea, and in kidney disease, it develops because the fluid burden becomes too much for the cardiovascular system to manage horizontally. Some people discover they've started sleeping with extra pillows without fully understanding why, simply because it's harder to breathe lying flat. If you've noticed that you feel more breathless at rest than you used to, or that lying down feels uncomfortable in your chest, this is not something to monitor quietly at home. This symptom, in combination with any of the other 4 signs mentioned today, should prompt a call to your doctor within 48 hours. Here's what I want you to genuinely understand about all 5 of these signs. None of them individually is a definitive diagnosis. But when 2 or more of these symptoms are occurring consistently, especially in someone over 60, the kidneys need to be investigated. The standard test is simple: a basic metabolic panel and a urinalysis. Your doctor can order both in a single blood draw and urine sample. The key numbers to ask about are your eGFR, your creatinine level, and whether there is protein in your urine, which is called proteinuria. Protein in the urine is one of the earliest signs that kidney filters are being damaged, and it shows up on a urine test long before your blood results look alarming. Now let me give you a clear action plan you can take starting this week. First, track your nighttime symptoms for 7 consecutive nights. Write down how many times you wake up to urinate, whether your legs feel swollen in the morning, and whether you experience cramps or restless legs. Be specific with details. Second, schedule a kidney function panel with your primary care provider. Ask explicitly for an eGFR, serum creatinine, and a urine microalbumin test. If your doctor dismisses your concern, it is completely appropriate to ask again or seek a second opinion. Third, review any supplements or over-the-counter medications you're taking, because NSAIDs like ibuprofen and naproxen, taken regularly, are one of the most common unrecognized causes of accelerating kidney decline in seniors. Fourth, reduce your sodium intake to under 2,000 milligrams per day, because excess sodium forces your kidneys to work harder and worsens fluid retention. Fifth, stay hydrated with plain water throughout the day, targeting around 6 to 8 cups daily, But check with your doctor if you already have a known kidney or heart condition, as fluid targets can vary significantly. And sixth, if you are on blood pressure medication, make sure your readings are consistently below 130/80, because uncontrolled hypertension is the second leading cause of kidney disease in adults over 60, right behind diabetes. One more patient I want to mention briefly. Frank, 68 years old, a retired electrician who thought his swollen ankles and restless legs were just circulation problems. He'd been managing his type 2 diabetes for 11 years, but had never been specifically screened for diabetic kidney disease. When we ran his numbers, his eGFR was 44. Starting dietary changes, discontinuing a medication that was contributing to the problem, and working with a nephrologist allowed Frank to stabilize his kidney function over the following year. His nighttime symptoms improved substantially. The key was catching it before it progressed further. Your kidneys can heal and stabilize when given the right conditions early enough. The nighttime hours are when your body speaks most honestly, and now you know what to listen for. If this video opened your eyes to something you hadn't connected before, I want you to comment below right now. Comment the word checking if you're going to schedule a kidney panel this week. Comment symptoms if you recognized one or more of the signs we discussed today. And comment sharing if you have a parent or spouse over 60 who needs to see this video. Your comments help this information reach the people who need it most. If you haven't subscribed to this channel yet, please do it now. Every week, I bring you research-backed health information designed specifically for adults over 60, the kind that's practical, honest, and genuinely actionable. Next week, I'm covering the 5 foods that silently damage kidney function and that millions of seniors eat every single day thinking they're healthy choices. That one will be important. I'm Dr. Sarah Mitchell. Take care of yourself, take care of your kidneys, and I'll see you next week.